Well, a warm welcome. It's Saturday the 24th of April. I'm going to look at a few global things today. Let's just start off with the background here. These are the global cases, and unfortunately we see they're increasing. So going down from the New Year peak into that's about February, March, and then they've been going up since, and the wave now is looking even higher. So this is a concerned increase in global cases, and of course deaths are following this, unfortunately. Anyway, this got me thinking about global vaccine supply, because we're going to see the success of Israel in a minute. But globally, vaccine supply. Now, there's still a problem because the US Defense Procurement Act is still in force. Now, it made perfect sense that this was instigated because it gave executives huge powers to organise vaccine production, which is being done. And the executive do say this does not inhibit exports, but actually what it does is it gives American firms sort of precedent, as I understand it. So there's not enough material sometimes left for export, and we're in a global supply chain situation. So things are moving around the world. It's not as if a vaccine is made in one place. There's components needed from all around the world, and this does seem to be interrupting it. So this chap here, Adar Poonawalla, head of India's Serum Institute, where they make most of the world's vaccines at the moment in Pune. If we are to truly unite in beating this virus on behalf of the vaccine industries outside the United States, in order to do that, I humbly request you lift the embargo of raw material exports out of the US so that vaccine production can ramp up. And your administration has the details. So here we have the head of the Serum Institute basically saying that his ability to produce vaccines is limited by materials being imported from the States, and this is largely because of the Defence Procurement Act. So this is a problem. And of course, we know that the need for vaccine in India is, it's just an extreme, isn't it? Because, I mean, we saw those distressing images just yesterday about the situation in India. So it looks like international supply here is a problem. And this is something that political leaders can sort out quite easily. United States and other Western countries. So would it be a good idea to rapidly boost global vaccine supplies? Of course. Well, one way to do that is temporarily suspend pharmaceutical intellectual property rights. So poorer countries could produce their own versions of trademarked vaccines. So it wouldn't be the Pfizer vaccine, but it would be basically the same, but it would be made by another company in a poorer country. Or it wouldn't be Moderna vaccine, but it would be basically the same, but made in another country. Now, of course, this sounds naive and idealistic of me to say this, but many are thinking on the same line. So here's the World Trade Organization proposal from March, asks for this very thing: waivers of patent protection for coronavirus vaccines. And apparently, from the popular news outlets I've been reading, blocked by the United States, Britain and members of the European Union. So China and Russia are focused on bilateral vaccine diplomacy. Now, it would be naive not to think there's implications of China and Russia supplying vaccines to countries. So if we were to waive the intellectual property rights, say for a period of a year, then poorer countries wouldn't need to rely on Chinese and Russian vaccines, and presumably that would be in the wider interests of European Union, UK and the US countries, you would have thought, but it doesn't seem to be happening. So even if we don't liberalise intellectual property rights, we really do need some movement from the United States on the Defence Procurement Act. So if you're a politician in the United States, please do bear that in mind. The head of the Serum Institute of India is saying it is a limiting factor for him. So World Trade Talk. Now, Namibia, just for example, African country, population 2.5 million, 128 people have received 2 doses of vaccines. I mean, basically it hasn't started, has it? Or another example from South America, President of Guatemala. President of Guatemala says this: COVAX has failed his country in Latin America at large. This is the United Nations World Health Organization scheme, basically. So Guatemala has received 81,000 of the 3 million of the AstraZeneca vaccines it purchased through COVID. So it's actually paid for these. COVAX, rather, the WHO scheme. And he says the COVAX system has been a failure. Now, that's not me making a political point. That is straight from the president of Guatemala. So, a small group of countries have all the vaccines and a large number do not have any access. Now, if we're serious about eradicating this virus, and I think we should be, we need to eradicate it with a complete avalanche of vaccines all at the same time. Otherwise, we're going to get more and more of these mutants like we're seeing in India at the moment. So, yeah, that's the problem. I don't pretend to have the answers, but that's the problem. It does seem, though, that if COVAX is not working, perhaps we need, shall we say, parallel systems of vaccine rollout that could be organised by the UK, the United States, people that are actually very good at logistics. Could maybe aid vaccine rollout, shall we say, in addition to the World Health Organization. India, it seems to be driven mostly by this new variant, B1617. Now, other factors are talked about. There's been a lot of electioneering. There's been a lot of it's the Hindu sort of festival season, the Kumbh Mela, with 5-10 million people, whatever it was, attending. But it also seems to be this new variant. Now, before the flights were banned from India, before people had to go into hotel quarantine on the 4 a.m. on the morning of Friday, yesterday morning, the airlines tried to get in an extra 8 flights. And people landing from India were pleased to get from India to the UK. And they were saying they were paying double or treble the fare. So, but these are all attempts to get round the regulations. This is what concerns me. This should have been we should have gone onto the red list as soon as this was announced, like last Tuesday, without any warning time. So we couldn't have, would have cut out this profiteering. And many people have got from India in the meantime, who are now going to be isolating at home, but often, as we've said, in households where people are going out to work or going out to school or whatever it is. And we really don't want this variant in the UK, because there's 103 cases at the moment in the UK. But how much of the surge, the tsunami in India, is generated by the transmissibility of this new variant? Well, we don't know. Certainly reports from India are indicating that this is hugely more transmissible. We haven't got scientific papers on it yet, but why take the risk? People are always talking about an abundance of caution. Well, they don't seem to have shown it here in the spreading of these international variants. India, unfortunately, deaths carrying on rising. There's a delay in the figures, so they're underestimated. That was Friday. That was Thursday official data. And we see the numbers increasing now, well over the 300,000. So that's the 300,000 line there. Been over that for a few days now. New cases. And again, we know that there's underreporting due to limited testing in India. So it looks like this new variant is driving quite a bit of this, and that is concerning. Patients are dying because of a shortage of oxygen in India. Simple statement of fact from the BBC and numerous outlets. For example, Jaipur Golden Hospital in Delhi, 20 people died overnight because of lack of oxygen. Time, place, simple fact. Government deploying trains in the Air Force to move oxygen around. Huge black market apparently in oxygen and medicines, because medicines are running low as well. Hoarding and panic buying. And corruption is playing a part. Hopefully a small part, but it's playing a part with these sort of activities going on. And because the positivity rate in India, as we looked at yesterday, is about 30%, this is going to go on for some time. And it's terrifying for India, but it's also frightening if this variant becomes established in other countries due to people trying to get around the international travel restrictions. Right. Israel. Daily deaths 0. First time in 10 months. Wow, such good news. 2 doses of vaccine, 53%. One of the leaders in the Shabab Medical Centre. Country may be reaching herd immunity. There is a continuous decline despite return to near normalcy. So this is the vaccination programme, according to this authority here, working in Israel. This is why we need this everywhere. Total vaccines here per 100 people. So Israel 120 per 100, so meaning that quite a lot of people have had 2 doses, of course. So these are vaccine doses, not people vaccinated. United Arab Emirates doing well. Chile, as we looked at a couple of days ago, doing well. Bahrain, then the UK and the United States. Pretty close, isn't it, between the US and the United States? Of course, going for different strategies. UK going for the longer gap, the US going for the shorter gap. Hungary, Qatar, Serbia, Uruguay. Now, I was complaining that there's very little information from Turkey. So here's the cases in Turkey, going up quite dramatically, but do seem to be levelling off to going down slightly now, which is encouraging. So I was saying there's not a lot of official news from Turkey, and that's the case. So several of you have emailed. I don't have permission to use names, but I've put this together from several emails that people have sent me from Turkey, so that's good. Now, there was loosening of restrictions early March. There seemed to be complacency in Turkey, exactly as there was in India. Complacency in early March. Restrictions were loosened. When if they kept them on for just a little bit longer, they would have started getting the vaccine effect like they're getting in Israel. Young demographic, average age 32. Government official data is very conservative, but apparently it is getting better and it is starting to catch up. But it's still making the numbers look less than they are. Apparently President Erdogan, controversial chap of course, but recent investment in the health service apparently, a couple of people have told me he has invested in health services. Private hospitals also recently increased in capacity, so that's good. But still they're nearing capacity now due to the increased number of cases. About 75% as many qualified nurses and doctors in Turkey compared to European countries, so somewhat struggling for staff. Intensive care units reported to be at 70%. Now, I find that hard to believe. I mean, we work at 70% occupancy routinely, without a pandemic, so I suspect it's higher than that. But it does seem that the positivity ratio is about 18%. 18% of tests coming back positive. If this is the case, it indicates a lot of community transmission and it indicates that this will be going on at a fairly high plateau for some time. So if there's that much community transmission, I wouldn't expect that to go down quickly. I would expect it to go down slowly, if anything, because that indicates there's a lot of community, transmission in Turkey. Now, the lockdown measures are strange. 7 p.m. to 5 a.m. curfews, full day curfew at the weekends, but not fully followed. Moving to online working, but factories and construction both working as normal, apparently. Currently good social distancing, mostly. Mask wearing, mostly outside. But on non-curfew days, the shopping malls are busy and open. So it is a bit of a strange approach. Large number attending funerals, smoking banned on busy streets, but lots of people smoking, which could be a source of spread, potentially. Now, vaccinations in Turkey, Sinovac and Pfizer. Russian Sputnik is arriving soon. They're taking the 2-dose approach like the United States, not the longer gap approach like the UK. Over 65s largely vaccinated, now vaccinating 55 and over, with people over 55 and those with health conditions, so it's progressing well. It's not going to be finished till October though, 18-year-olds till October. Schools are closed except for preschools, and I think grade 8 must be the sort of 16 to 18-year-olds. Health Minister says the situation's improving. Well, maybe slowly. So thank you for that, the people that wrote in. because not a lot of news from Turkey, so that does help quite a bit actually. Now, last country to look at today, Germany. Nationwide emergency brake probably comes in days. This kicks in whenever infections in a district exceed 100 per 100,000 for 3 days in a row within 7 days. This is sort of fairly complex German ways of thinking. Amendments to the Infection Protection Act must then be passed by the Bundestag, planned to last until the end of June. So new restrictions till the end of June by the looks of it. But this is the complications in Germany. Everything seems to go through systems, which can take a long time. For example, it took ages before GPs were giving simple vaccinations. So I think that illustrates sort of a national problem really in Germany. Now, moving on to Australia. Western Australia is currently locked down for 3 days. It's locked down till Monday at the moment. Now, there was a case, someone had been released from a quarantine hotel after 14 days in a quarantine hotel. And then a few days after that, they were diagnosed as positive. And it looks like they got the infection from someone who was across the corridor from them in the quarantine hotel. Now, if you didn't know better, you'd think they would open the doors in the quarantine hotel and were having a chat. That's what you might think. We don't know that. But they seem to have caught it from the person across the corridor. Anyway, Nigel has come on to talk to us from Perth. A very long-term experienced doctor in Perth. And we talk about this for a while. I do get a bit distracted when I start asking him a few extra questions, but it's an interesting chat. So we'll listen to that. And then that's us for today. So let's, Nigel, thank you very much. Well, I'm delighted to have Dr. Nigel Farrier with us again from Western Australia, Nigel, isn't it?
Yes, that's right, just south of Perth.
Near Perth, yeah. Now, I believe there's something happening there, and it does sound a bit concerning. What's the background, Nigel?
We about a week ago, there was somebody in hotel quarantine. Everybody who comes into Australia has got to go into a 2-week hotel quarantine. And a week ago, he tested negative a couple of days before, and then he was released on his 14th day. And then he stayed in Perth for 5 days, sort of doing touristy things. He stayed with a family. On the first night, and then he stayed at a self-contained unit at one of the local universities for the next few nights, and then he flew to Melbourne. When he arrived in Melbourne, he got tested and was positive with the UK variant. And so he'd been out in the community for 5 days, visiting places, going to restaurants. They immediately tested the woman and her 2 children. She turned up positive on, yesterday, Friday, my time, and her 2 children were negative. So our Premier, Mark McGowan, then went and called a snap 3-day lockdown because that's the first case of community spread that we've had since, I think he said, April the 11th last year. Yeah. So then they started contact tracing. We've got a very good app here called Safe WA, and you just click, open it up and point it at a QR code at the entrance to everywhere that you go, and it just registers the time that you were there. So they started doing contact tracing for this person, the male who's now in lockdown in Melbourne, and also this woman who actually on the Thursday, which is 2 days ago, did her usual shift for the full day at a dentist. So this gentleman went and ate at a restaurant, and this afternoon, one of the people that were in the restaurant tested positive, and then a few hours later, it seems to be another person has tested positive. So there are now 3 cases in Perth from this one guy, and the source of his infection, he caught it at the hotel, on the floor of the hotel he was staying on. There were two other rooms that have got COVID, and they caught it. They got the UK strain as well, the same as this gentleman. So he tested negative before he was released, but he caught it there. So there's a big hullabaloo going on about the hotel quarantine. They've shut that hotel for the moment. The state government is arguing with the federal government over who's to blame.
Yeah, I was thinking 14 days, it'd be remarkably unlikely that anyone would develop the infection after 14 days. So he's obviously caught it from someone who's like recently checked into the quarantine hotel.
Yeah, I've got no information regarding the two families or people that were tested positive on the floor. One was right opposite his hotel room, had the room on the other side of the corridor. Right. One was 2 doors down, I believe.
And as far as we know, these are all the UK variant, as far as we know.
Yes, as far as I'm aware. The thing is that this is not the first time we've had hotel transmission. A month or two ago, we had another snap lockdown because one of the hotel guards contracted the UK strain from somebody on the floor that he was working on. So it's a bit of a problem. As I said, we're currently now in lockdown, and if these cases continue, then the 3-day lockdown, which finishes for us on Monday night at midnight, will be extended. There'll be no question about it.
Yeah. Right. So obviously the contact tracers are going flat out now to look for other contacts, get them all tested, get them all.
Yeah. Fortunately, the first woman who was tested positive that he'd stayed with on one night faithfully used the Safe WA app. So they've been able to chart her movements and contact people who also use the Safe WA app. But they also, if you don't want to use the app, you have to write your name and phone number on a contact sheet at the entrance to the shop or premises. So they've been using that, and the contact tracing seems to be going extremely well. I mean, over in Melbourne, they want to trace the 100 and something people that were on the flight with him. Apparently 49 people so far have been tested, and they were all negative, so fingers crossed.
But of course, you need to wait a few days sometimes for the test to become positive. So I guess it's all those people will be isolating in the meantime.
Yes, they've been told to isolate for 14 days, everybody on the plane.
Well, it's good to see that Australia's on top of that. And what's your gut feeling? Do you think they'll have caught this, Nigel?
Well, the last time it happened, I think it was January, we had a snap 3-day lockdown, and it was the UK variant, and it was out in the community with the security guard, and we had no more cases. And I was expecting, a few more cases to crop up. This time we've now got 3 or 4 cases, and I don't know if it was caught soon enough. That security guard from before, because they sort of been testing them regularly, it was probably caught before he could pass it on too much. Whereas this time, he was out in the
he was out and about,
visiting places in Perth for 5 days, then flew to Melbourne and then had a test. I forget whether it was the next day or whatever, and that came positive. So there was basically 7 days where this was potentially being passed around.
Yeah, it just shows, doesn't it, that Australia is just on a knife edge all the time. Unless it completely banned flights altogether. I mean, these are mostly nationals coming home, aren't they? But just one. And we know this UK variant's more transmissible. It's just, it could so easily go into community transmission. It's just, I'm just so pleased Australia's done so well for so long. But this really is a bit of a wake-up call on getting the vaccine rollout, do you think?
Yeah, I could say things about our vaccine rollout and its non-existence. It's not very very prevalent at the moment. I think they've just opened it up certainly in Western Australia to anybody over 50.
Yeah.
You get the AstraZeneca vaccine. That's it.
Yeah.
And of course, people are going, I don't know if I want it. We've just had 3 more cases in the last day or two of blood clots after the AstraZeneca vaccine.
Do you know, is it blood clots associated with thrombocytopenia, do you know, Nigel?
I don't.
Because this is the key thing, isn't it? It's blood clots with thrombocytopenia.
So it was a 35-year-old woman, a 48-year-old man, and an 80-year-old man. And out of those, there was one CSVT. CVST.
Cerebral sinus venous thrombosis.
CSVT.
One up there, yeah.
Oh.
Which is, I mean, just out of interest. Sorry, go ahead. I'll ask you a question in a minute. Sorry.
Yeah, okay. So one was the CSVT, one was a calf vein thrombosis, and one was an upper leg vein thrombosis. So I've got no more information. I haven't heard anything whether these are associated with the platelet factor 4 antibody and the thrombocytopenia.
Yeah, the platelet factor 4 antibody, where you get the combination of these strange blood clots and the thrombocytopenia, tends to be, most of the cases so far have been the cerebral sinus vein thrombosis or splanchnic related, often occurring in the hepatic portal vein. So if it's a DVT in an upper leg, what is another form of deep venous thrombosis, really? I mean, as a GP, I suspect you've seen a lot of DVTs and pulmonary embolisms over the years.
I did, yes.
This is very common. A&E, it's virtually a daily occurrence. But did you ever in your medical career see a cerebral sinus venous thrombosis?
Not to my knowledge, no. Remarkably
rare, yeah. And I think also the splanchnic thrombosis affecting the hepatic portal vein. Also, do you have any memory of seeing one of those?
I didn't, but a colleague I was working with diagnosed one.
Right, he's on the ball to catch that.
I was gobsmacked that he got it.
Yeah, it's very on the ball.
Because he sent them off to hospital, and the hospital phoned him up and goes, "What are you talking about? That's so rare. It's rubbish." Yeah. And he said, "No, test for it." So they did, and they phoned him back and go, "Oops, sorry."
Well, I imagine he was fairly pleased with himself. That's a pretty on the ball diagnosis.
I think the patient was pretty pleased with him as
well.
I'm
sure he was, yeah. I mean, thrombocytopenia on its own, I mean, this is something we see in children from time to time, isn't it?
Yes, HSP or idiopathic thrombocytopenia purpura. Yeah, I've seen many of those cases, yes. But nothing in association with heparin. Not that as a GP you used a lot of heparin to treat things. That was more in hospital for prevention of thrombosis, pre-op and so on.
Well, of course, in hospitals, I've used huge amounts of heparin over many decades, and I'd never heard of this. What is it? Heparin immune. I can't even remember what it's called. Heparin immune. Heparin-induced thrombocytopenia.
Thrombocytopenia and thrombosis. And now they're calling this vaccine-induced one VIT.
So I suspect that the cerebral sinus venous thrombosis, that one case, could be vaccine-related. But as we know, the normal deep venous thrombosis in the calf and the upper leg are unfortunately very common pathologies. So
and I don't know which one was in which age group. I've only heard the 3 ages and the 3 different thromboses. So I'm still trying to find that out, but until it reaches sort of the news people, and of course all the news people are going, "Oh, it's due to the vaccine." All of them.
Yes, this is a problem, isn't it? But by the way, if you're still watching, me and Nigel have somewhat wandered off the Australia thing, which is concerning. No, not at all, not at all. Can I run a question past you, Nigel? I suspect that about 1 in 5 to 1 in 10,000 cases, when you give an intramuscular injection, you can give inadvertent intravascular medication. That kind of rate, but we know we're dealing with a very rare side effect here. So I'm just wondering if inadvertent intravascular administration, because the World Health Organization guideline is to stick your needle and not to aspirate. You just inject straight away, which I'm sure goes against your training.
That's the case in Australia.
Yeah, it seems to be the case everywhere.
I mean, over the 40 years that I was a doctor, because I'm retired now, I would have given thousands, tens of thousands of intramuscular injections. And even if you do withdraw, I think maybe once in my lifetime, I go, oops, better move the needle tip.
Yeah.
The interesting thing was you quoted a paper on injecting mice with adenovirus, and they developed the clots.
Yes.
Reading that paper, it seemed to be a slightly different mechanism to the current protein factor 4 antibody formation.
Right.
So, I'm still in two minds as to whether it's relevant or not. The problem, I think, is that with the COVID itself, if you get it, you are very likely to get thromboses. One of the problems they have with people in intensive care with COVID is the thrombotic events that they're getting.
Yes.
And you yourself have spoken about these many times, the thromboses in the small capillaries in the lungs, causing problems with oxygen transfer. So whether it's down to an intravascular part of the vaccine getting into the blood vessels, or it's just part and parcel of COVID itself, I don't know. I'm tending to think it's the latter part of COVID, and because we're injecting spike protein to develop spike protein antibodies.
At the same time, someone could potentially have acute infection coincidentally.
Well, not that. It's just part of the injection being creating antibodies to the spike protein.
Be
part of the problem of developing the clot as it is in the disease. I don't know.
See.
I don't
so
think
it's like a mimicry effect almost.
Yes, I think so. So I'm tending to err on that side rather than the intravenous injection of the virus, the antigen and the antibodies.
Yeah, it just seems to be a variable though that could so easily be eliminated with a change in protocol, because clearly, we've both been giving intramuscular injections since the 1970s, and it's just so automatic that you stick your needle and then aspirate. To me, I just can't do anything else. And
I've been giving injections since the very early 70s. So.
Yeah. I gave my first one in 1975 when I was 18 years old. So, but no, it just seems a variable that could be eliminated to me. And if you've got a few variables, why not close off that gap in the Swiss cheese, and then that leaves you to think about the other bits.
It's such an easy thing to do, and to have the protocol of withdraw before injecting. It doesn't take more than half a second.
No, that's right.
You're not going to extend it. So, look, I would agree. I think it's a simple thing to do to prevent something that's a small possibility, but who knows?
Yep. Great, Nigel. Thank you for that. So just to conclude, Perth locked down for 3 days. No more cases, then the lockdown will be lifted on Monday, or what's?
I don't know what the government's thinking. As I said, we've had 2 cases in a restaurant where this gentleman ate, and one female that he'd stayed with. So that's
they'll be following those up.
Yeah. So if there's any more, I reckon we will extend the lockdown. If there's no more, I'm still not sure. I think our Premier and the Health Department would like about 3 days without any community spread.
Which makes sense. I mean, Australia's gone so long, and Australia has been one of the so few proactive governments in the world. It would just be tragic if we had community spread at this stage.
And the interesting thing is, like in America, where they're all protesting about having to wear a mask, in Australia, our Premier, when he called the lockdown, they did a news poll, and 82% of people approved.
Yeah.
And because they called the lockdown yesterday afternoon, I couldn't get to do my usual Saturday shop, which I was trying to do yesterday before we shut down, but I didn't. So I went out to the shops because we were allowed to go out for grocery shopping. There's only 4 reasons, and that's one of them. And there weren't all that many people in the shopping centre, but every single person was wearing a mask and wearing it correctly. Everybody had their nose covered. I was actually pleasantly surprised because the last lockdown we had, half the people had it under their nose.
It gets on my nerves, that. I can't stand seeing it.
It gets on my nerves as well.
What's the point if you're not going to wear it properly? Yeah.
I mean, you and I are both used to wearing these masks.
Sure, I suppose so, yeah. Nigel, would you like to bring us up to speed next week and what's happened? And, we'll be hoping for good news, obviously.
I'll certainly try and do that for you.
Yeah. Thank you, Nigel. Appreciate it. And your medical insights there. It's so interesting and just so much to keep thinking about. So certainly appreciate that. Thank you very much.
No worries. Thanks, John. Keep up the good work.
Thanks, Nigel. Nigel, sorry I kept you talking for so long there. That was that was me asking an excess of questions. So that was Dr. Nigel Farrier in Perth. Interesting insights, and we will be checking back next week. And let's hope that there are no more community transmissions in Western Australia. Just shows how easy it is, though, to get out. It really is quite a poignant lesson, that one. So that's us for today. Thank you if you've stayed to the end, and thank you for watching.